Thank you again for being here for our next city briefing and update. We are at April the 22nd. It is Earth Day, actually the 50th anniversary of Earth Day today. And we are doing our briefing this Wednesday. And of course, I want to begin by thanking Alice from the Health Department, who will be doing our update in Spanish in just a few minutes. So en español vamos a tener un resumen en español después de esto. And then, of course, Paola, who's right behind us, who's doing our ASL translation. And we're joined, as usual, with Dr. Davis from the Health Department, who will be giving us more updates about what's going on with our health orders and the city as well. So we'll have several updates today, but I want to start with probably the one issue that we're getting the most questions on, and the one where we have a lot of great information to share as well, and that is as it relates to testing. Let me begin by giving you some overall data and some overall numbers. And some of these numbers are approximate, and I'll explain why in just a minute. Let me start with going over our numbers. We believe in Long Beach that through both our partners within the health world, so our private health partners and our drive-through testing centers, that we as a unit have done a significant amount of tests. So we estimate that we've completed in Long Beach about 4,700 tests for COVID-19. And of those 4,700 tests, about 2,300 of those have been through our 4 drive-through testing centers, most of which of those were open just this week. And another 2,500 of those have been through private labs and our health partners across the city of Long Beach. So how did we break those down? I want to begin by mentioning that of those, we think that through our main health department lab, and that's been our main drive-through center in Long Beach, we've done about 430 tests. Our Long Beach City College Pacific Coast campus site, we've done about 1,100 tests, 1,170 tests. Through our Jordan High School site, we've done almost 400 tests, and this is as of today. And our Cabrillo High School site, we've done about 180 tests. And so those numbers, when you combine those and you look at what we're doing with the amount of tests that have been done through our private labs, we approximate about 4,700. The reason why it's an approximate number is we don't always get an exact count from all of the private labs. Of course, we have direct counts in our 4 drive-through centers, but it's a little bit more broad. And so we are doing a lot of tests. We have tripled our testing capacity in just this last week. And as you can see, we are getting a lot more of these tests at our drive-through centers. We want to encourage folks that if you have a symptom, to get tested. So if you have a symptom, you're feeling like you are sick or have these flu-like types of symptoms, these COVID symptoms, please go get tested either at Long Beach City College on Pacific Coast Highway, at Jordan High School, or at Cabrillo. And of course, we also have now our St. Mary testing center as well. And we're getting those numbers coming in. And when we include those numbers that we're going to be getting in the next few days, we certainly are over the 5,000 tests. And we're going to have a clearer picture of those numbers towards the end of the week when we have a full week of data. And so that gives you an approximation of where testing is going. I mention all of this because we want folks to get screened and get tested. They can go to the longbeach.gov website, click the testing page, and then you can pick which testing site you want to go to and go right through the testing process and get screened right there and make your appointment. There are appointments available. So my message to everyone is if you feel like you need a test and have symptoms, go right now today and get a test, make an appointment for the next day or so at one of our sites. That gives you the broader testing picture of where we are. And of course, I want to share some of our general numbers for today. We are up to 489 residents who have been tested positive for COVID-19. I also want to report, sadly, that our total deaths are about 27. We know that these numbers are always changing, and our thoughts and, of course, are always with the families, and our prayers are with the families, and, of course, the friends of those that we have lost. So far of the 27, all have had other underlying health conditions, and they have been, of course, through their 50s all the way through their 80s. That has been the age range of these individuals. We continue to lose folks, but we also continue to see positive recoveries. And so that is also the positive thing. I'm not sure, I think we want to say that we're almost at 300 recoveries of individuals that have recovered from COVID-19. That is a good sign. That number also changes, but it's something that we're continuing to monitor and are very, very grateful for. And so again, we expect as this testing is ramped up, that our positive COVID number is going to actually continue to increase. And we think we may even see a spike over the course of this next few days or week, because there is just way more testing happening this week than there was last week or the week before. And so we're going to keep an eye out for that. We're going to let folks know how that is going. Our hospitals, just so you know, are working really hard. None have reached a point where they are overburdened with capacity or full. We've created all that extra room and all those extra beds in preparation, and they are doing really, really well. That's not to say it's not a difficult environment, that our nurses and doctors still don't need our help with these stay-at-home orders, but we are, as a community, we're managing, thanks to you, thanks to all of you, being responsible, being at home, listening to the advice of our medical team. We are able to flatten this curve and are really providing a level of relief that our hospitals need right now, because they are seeing COVID patients on top of all the other patients they have in those hospitals. And so thank you from all of them, and let's keep that work going. And so we'll have more information on that as that continues, but so far we are doing okay, and we got to stay there. I want to bridge that to a conversation that the governor had earlier today. The governor announced earlier a huge ramp up in testing statewide, and so you probably are reading that he is announcing additional testing sites all up and down the state of California, and expects to ramp up testing dramatically within this next week. We are working with the governor on that initiative as well, and so we are hopeful that we will have additional drive-through testing capacity moving forward. That's all being worked out right now through the governor and our partners at LA County, but that's something we hope to have more information about in the near future. So even more testing capacity is on its way. I want to add on a couple other items that are important. One question that we always get is the street sweeping question. As people probably know, the city has not been ticketing for street sweeping, and we've been doing that over the course of this last month. We believe that folks that are struggling should not have that additional burden of having to move their car, especially in parking impacted areas. We also know that street sweeping is really important to keeping the city clean for water quality and to clean storm drains. And so please know that while this is a temporary measure, that we have to get back to fully street sweeping the city. So what are we doing? What's the plan moving forward? As you've probably been aware, the city paused giving out citations on street sweeping. We did that because we wanted to give people that relief, particularly those that are struggling. That citation relief was set to end at the end of this month. So that was going all the way through until the beginning of May. Last night, the City Council extended that citation relief by an additional few weeks. And so now the date of the resuming of that citation enforcement process won't be until May the 18th, which aligns with our current end of our stay-at-home order. And so that doesn't mean, by the way, that the stay-at-home order is going to end on the 18th. There could be changes. There could be an extension. We could see some changes that relates to the economy around that time. We just don't know yet. But that's the alignment that we've now done. And so what can you expect to see? The first thing you can expect is that beginning May the 4th or early May, our street sweepers are going to come out in full force across the city. We have been doing already street sweeping across the city. That hasn't stopped, but it's been difficult to do because a lot of cars aren't being moved, which we understand. Beginning May 4th, we will street sweep the entire city. We're asking folks to move their cars and to please move their cars. We've also provided over 5,000 free parking spaces across the city for people to park their cars temporarily. And again, at the longbeach.gov website, you can apply for a free parking permit in one of these parking lots to move your car, and you can keep your car there if you like as well. So beginning May 4th, you're going to see the street sweepers out, and they're going to try as much as they can. If there's a car that has not moved, we're not going to give you a citation, which was the current plan, as we probably know, towards the end of the month. We're going to leave a warning on your car and just ask folks to please understand that in a few weeks after that, we have to go back to enforcement, because if we don't enforce, we won't be able to sweep the whole city. We're going to have massive trash collected, public health and safety issues, and storm drain issues. We are required also from a water quality perspective to keep the water system free of debris, and this is causing us some issues which could cause us serious infrastructure issues as it relates to water quality. And so May 4th, street sweepers come out, and then for the 2 weeks after that, we will start giving people basically messages to let them know that street sweeping will resume with enforcement come May 18th, but also options for folks, giving them lists of where the free parking is, showing them how we can help them move their car. And so just know, everyone, that we want to work with you. We have been very lenient because we think that it's the right thing to do, and we're going to continue to assess and be flexible. We don't want to put any burden on you guys, but we also know that we've got to clean our streets. So we're trying to find a right balance, and we'll have more information on that in the weeks ahead. If you want a free permit, please go to longbeach.gov/parking. It's longbeach.gov/parking, and you can get your free parking permit. And again, we have already, I think, about 1,300 of you have applied for a parking permit, which we're providing for free. We have an additional over 4,000 spaces ready to be used by the community that we've set aside. So please use those if you can. And as a reminder, you can still receive a citation if you park in the red in front of a fire zone, or if you park in the blue. And why is that? Is that red and these blue zones are emergency turn lanes. They're there so that a fire engine can turn at the appropriate radius, and they're there in case there's a fire, we can plug in and get water and save lives and property. And so those areas have to stay clear, and you cannot park in those areas because of the life and safety issues. And because we have a lot of folks calling in and having needs around COVID-19 also from our paramedics, we need to keep those clean. So please, red curbs, blue curbs, white curbs, now those continue to have enforcement, and just remember that, please. I want to now just transition to a couple other topics. We have, of course, we have an amazing library system in Long Beach. I want to remind folks, especially that while you're at home, that we have a library at home program here in the city. If you go to our library website from longbeach.gov, you can access thousands and thousands of free books, and audiobooks, podcasts, all sorts of different things that will allow folks to get resources and books into their home. We know that people want access to these programs. They are all available at our libraries. You can also, there's practice programs there for taking SATs, for citizenship, to help people navigate legal questions. There's all dozens of programs that are available through our library system. And all you have to do is sign up for an online library card to access all of these programs through our library system. So I encourage you to use our library at home program that's available now for the community. I also want to note that We announced yesterday our Economic Recovery Advisory Group. We listed the members yesterday. We put together a great group of business leaders, community leaders, innovative thinkers to really share with the community and with the city and us what is the best way to reopen the economy in a way that is safe to the public. Now, we know that when the question of when the economy opens is one that's going to be left to science and data and our medical professionals. But how we do so, and the safest way to do so, is a question that we need to be asking the folks that are in our businesses on the ground, our small business owners, and our great thinkers here in the city and across the state. So we are going to be getting and collecting the best ideas so that when we begin loosening up these restrictions in these weeks ahead as we have this conversation, we're going to have the best plans in place, because we know that people are out of work, we want the economy to restart, and we want to do it in a safe way. And we are not going to be pressured into reopening things before it's safe. We're going to do those in a way that is appropriate. And so I want to thank Mayor Bob Foster, who's leading that group, and the 20 members that are all a part of that group that are going to be providing their recommendations over the course of these next few weeks. And I want to thank them. And the last thing I'll just add before I turn this over to Dr. Davis is, again, we are celebrating 50 years of Earth Day. It's ironic that on this Earth Day, most of us are inside or are at home and are not able to enjoy our amazing planet and our parks and our beaches the way we would love. It's also, of course, ironic that our sky and our air quality is probably the cleanest it has been since we've been celebrating Earth Day. But we want to just thank you for conserving water and still trying to practice the best that we can around this important commemoration that we have every single year. Again, I want to thank all of you for continuing to watch. We'll have more information on Friday. And now I'd like to turn this over to Dr. Davis, who's going to give an update as well.
Thank you, Mayor. Good afternoon. Over the weekend, we increased the city's capacity to test up to 500 people daily. Like the mayor mentioned, as we continue to ramp up testing across the city, we anticipate the number of positive cases to also rise. If you're waiting for your test results, please follow the quarantine and isolation health orders as they apply to you. And you can find those on our longbeach.gov/COVID-19 website under View Current Health Orders. If you test positive in one of our drive-through testing sites, you'll receive a phone call and a letter in the mail. At this point, you must isolate yourself in a separate room from others in your household who are not sick. You should notify any close contacts of your status and tell them to self-quarantine. If you test negative, you'll receive an email. If you don't have an email address, you'll receive a phone call. Protecting ourselves, our households, and our community comes down to each of us, following the guidelines to self-isolate if we're sick and self-quarantine if we've been in contact with someone who is sick. Close contacts include individuals who live together, intimate partners, and anyone who's been within 6 feet of a contagious person for more than 10 minutes. Even people who haven't been tested but are exhibiting symptoms of COVID-19 should isolate themselves at home until they are cleared and notify any potential close contacts that they should self-quarantine. And I just want to review what being cleared from self-isolation for COVID entails. So number one, there should be 7 days since your symptoms started. Number two, there should be 3 days of no fever, and that's without using any fever-reducing medicines. And number three, your symptoms should have improved. So that's how you can clear yourself from self-isolation. And if you're a close contact and you're self-quarantining, you need to do that for 14 days. So I want to turn to the heat wave that we're expecting. The City of Long Beach expects a heat wave starting this weekend. We're recommending that all of our residents stay hydrated and wear light clothing. If you must leave your home to seek a cooler climate, please continue to maintain 6 feet of separation from others. Carry a mask, a cloth facial covering, in case you find yourself in an area where you cannot physically distance yourself from others. If you can't maintain a physical distance of 6 feet, put on the cloth face covering until you can get to that distance. Finally, for all latest information and updates, please continue to check our website, www.longbeach.gov/COVID-19, and you can also follow us at Long Beach City on Facebook, Twitter, and Instagram. Thank you.
Thank you, Dr. Davis. We'll do questions from the press, and then after that, we will turn over for our Spanish recap from Alice Castellanos from the Health Department. So, Jake, questions?
Yeah, the first question is from Rachel from ABC7. Go ahead, Rachel.
Hey, so this question is for the mayor. Governor Newsom mentioned earlier that hospitals will now be rescheduling surgeries amid the coronavirus emergency. So can you tell us what would be the first step in starting to reopen the city? I know you had mentioned the Economic Recovery Advisory Group, but are there any plans in place, and what would come first?
So obviously, we were heartened to hear the governor making that announcement today. And so, of course, all of our hospitals, and that are all part of different systems, will be making, of course, we'll be planning kind of how they incorporate those recommendations, right? And so that's going to be hospital per hospital, system per system phase in. As it relates to the reopening of the economy itself, I can tell you that the amount of work and that went into how we kind of shut down the economy and kind of got people to stay home, and all of that coordination, that level of work, which was a huge statewide effort, is going into how we reopen in a way that is safe. So not only do we have the governor and the state and their principles, they are continuing to put out guidelines and are going to be setting some type of statewide baseline for all cities and counties to follow. Then, of course, we have our local economic recovery group who will be meeting. I believe they're going to be meeting within the next few days, and they're going to be putting together a set of recommendations on what the best way to open is when we reopen, and what are some of the innovative ideas out there for a small retailer, or how do we reopen some of these recreation activities that we want to see. How do we ensure that that restaurants in the future can operate in a way that is safe, that is creative? So they're going to come up with some really great ideas and present those to us, to our health officers, so that we take all of those in, and that the health department is able to put out a very clear and clean set of reopening orders when we are ready to do so. So the key question is, I am confident that we're going to have a great plan of how to reopen. And I have heard from restaurant owners, from folks that are park enthusiasts, from small business owners, from folks that own coffee shops. And these small business owners have the absolute best ideas on how they can make their shop, their business, their restaurant safe. Social distancing, facial coverings, separation, limiting occupancy, the way that they interact with customers. So the ideas are going to be there. The key question to me is the question around when. Mm-hmm. And the when question is very different than the how question. I think the how question is what we're working on furiously right now. The when question has to be guided completely by what's the right thing to do as it relates to public health. And that decision is going to be led by the people that know the most about public health: doctors, scientists, and our health professionals. And that's the advice that we're going to listen to statewide. It should be the advice we're listening to across the country, and it certainly is what we're going to be doing here locally. And so that when question is something we're discussing, and we're having that conversation every day. I'm having that conversation tonight with the group of mayors from the largest cities in the state, having that conversation in a few days with our friends, with Mayor Garcetti and the supervisors in LA County. So we are really struggling with this, but we want at the end of the day, parks and beaches open, especially if folks can wear face coverings. They have not made those determinations yet. And I think that all of us should be taking our advice from the medical professionals. I think, unfortunately, you do see some other places across the country and other locations moving, in my opinion, too quickly and not taking the advice in many respects of our own CDC and our federal authorities. And so I think that everything will reopen when it's safe to do so. So that's just a continuation of that question.
Great, thank you, Mayor. Dr. Davis, there's a question relating on our social media, and I'll just ask this question, then we'll get back over to our media to allow them to get back online here. But how are the positive residents in nursing homes being isolated? Can you elaborate a little bit on the process within our nursing homes and how to minimize the spread of COVID-19 in that community?
So the health department works very closely with the facilities to make sure that we are cohorting positive residents. So that means we put them all together. And then that we also are managing and really paying a lot of attention to where we put the quarantined residents as well. So those that are not positive but have been exposed, so that we can watch and monitor for symptoms. So there's actually a lot of conversation that goes back and forth between the health department and the facilities to make sure that we have everybody in the safest place as possible, and that we're also limiting which staff interact with the positive patients versus the staff that interact with the negative patients.
Great. Thank you very much, Dr. Davis. All right, we're going to go over to our media inquiries right now. We have Kelly from the Long Beach Post. Go ahead, Kelly.
Hi, this question is for Dr. Davis, and this actually follows up on the nursing home question. LA County today announced a new strategy to begin testing all individuals in nursing homes, staff and patients, regardless of whether they show symptoms. Want to know if Long Beach was going to plan on following this lead, considering the high rate of deaths in nursing homes in our city. And a second part of the question, LA County this week is also planning to release the number of fatalities per facility, which Long Beach hasn't yet released. Want to know if Long Beach is planning on releasing those numbers, and if not, then why would that be?
So thank you for the question. So the first part of the question is about testing in facilities where there have been positive cases. Yes, Long Beach has been in active discussion with state and federal authorities about expanding testing to asymptomatic individuals, both staff and residents in facilities where there have been positive cases. That will help us to inform our decisions about cohorting and having patients and staff be in the safest place possible. So I do think that that's an expansion that we will be doing as well. And then to your second question, so we are we're following the state's guidelines as far as information that's released. We feel that it's very important to release actionable information that helps the public health. And so following the state's guidelines and the guidelines that the majority of counties throughout the state are following, we will release the information that they're releasing, which doesn't include fatalities at this time. But that is always an ongoing conversation.
And I'll add to that as well, just because I think this is important. I think there's been a lot of interest. So we're aware of the move the county is making as it relates to reporting. It's always been our intention to follow kind of the state standard on reporting, but there is a right for the public to know as much information as possible within privacy law as it relates to public health. And so that exact question, Kelly, that you asked, I was in a conversation just earlier today with our leadership on, and it is being actively discussed, and I expect, and Dr. Davis, you stop me if I go too far, but I expect that within the next 24 hours or so, we're going to have a more definitive answer on what the next step is as far as releasing information, because it's being actively discussed right now on how far we can go as it relates to within state law. And we have tried to follow and or partner with the county on the way reporting is being done, and so we're aware of that, and we know it's a critical issue, and it is for us as well.
Thank you, Mayor. This next question is geared towards Dr. Davis, and it really talks about expanded testing. Will that include individuals that are maybe asymptomatic, but people that are working in essential businesses? Do you have a plan for that, or is there an anticipated plan for that?
So right now, the plan is to expand asymptomatic testing within the long-term care facilities where they have outbreaks. There certainly is discussion about expanding asymptomatic testing. We want everybody who needs to have a test or feels like they should have a test to be able to have a test. So as the testing expands, we definitely will welcome everyone who feels that they need to have a test.
And I'll add, I think one of the great things about this expansion that the governor is talking about is we have to do a lot more testing. And so in Long Beach, when we launch these testing sites, we've been seeing them get busier every day, and we're seeing them get more and more capacity. And so as we add more testing, and we will be adding more testing even beyond the 500 capacity that we have right now daily, dependent on, of course, the folks that are coming in, how those appointments are being utilized. We're going to be looking at other essential type workers, first and foremost, our skilled nursing facilities, and other types of folks. When we're talking about, is it first responders? Obviously, we want to make sure that our medical personnel and other frontline folks can get a test when they need it. But those decisions have yet to fully be made, but they're being considered as the state expands their testing. And that actually was alluded to today by Governor Newsom. And so when we get our next testing site, drive-through site or testing site, which will be in addition to the 4 we have, and we will get another one, we're working with the state and the county on what that one will look like, and maybe it'll be a little different than the others, and we're having those discussions right now.
Mayor, this is another question from social media, and it relates to around the Economic Recovery Advisory Group that was established. And one of the individuals here on Facebook asked, are these salaried and paid positions, or are these individuals that have volunteered to step into this role?
All volunteer. They're all doing this because they love our city like all of you do. And so these are folks that are all volunteering their time, and we're very, very grateful to them. So thank you.
Dr. Davis, we'll go ahead and wrap up with this question, but there's some individuals out here that are waiting for their test results, and they really haven't been notified, and some of them are going on a few days, and like to know how long should they wait, and where do they call if they're not getting the results in a timely manner?
We'll post where they can call, but we're actively working with the laboratory to get results for folks that have been tested. And we will be calling or emailing or sending letters as soon as we get these results.
And folks should know the reason there's delays is because we can perform the tests, and we do, but then they have to go to a lab to get those tests obviously completed. And as you can imagine, the backup at labs up and down the state and the country is enormous. And so some labs will have different backups than others. We've noticed that in the labs that we work with in Long Beach, we right now have some labs that are turning around a result in 48 hours. And so some of you that are getting tested in Long Beach are getting a 48-hour result. In other cases, you might be getting a test in Long Beach that might be going to a different lab, and that might be taking 6-7 days. And that's not just a Long Beach challenge. That's actually happening all across the country, where you have different locations where you can get a test and you can get results back in a day or 2 days. Other places you can get the same exact test or a similar test, and that might take you a week. And so we're trying to also move our resources. So if we know a lab is not performing as they should be, we're trying to get the other labs that are able to take more capacity to cover more of the tests. So that's something that's happening and moving very quickly. And we've already made quick adjustments, but we do know that there is a group of folks that got tested in Long Beach, and their results took longer than they should have, because of a issue with our lab partnership at the LA County site we had at Long Beach City College. So there were some challenges there, and those have been fixed, and we're continuing to adapt and change those.
Great. That seems to be a majority of the questions that we're getting, and obviously this is something that we're continuing to work towards. You know, Mayor, today is Earth Day, and we want to really make sure that people are aware that they're getting some feedback here on Facebook that the streets are full of used gloves and masks. Could you just talk a little bit about what we're encouraging people to keep our city looking good?
Yeah, I have no, I can't believe that I have seen, as many of you have, folks throw their masks or their gloves onto the floor in parking lots. It's completely irresponsible and no regard for public health or safety of other people. And again, on this Earth Day, we should never be littering. But to do so during a health crisis like this is really irresponsible. So please keep our city clean, keep our planet clean. Don't litter, period, no matter what it is. And let's take care of our community and the folks that live here.
Thank you very much, Mayor. One question about volunteering. Folks, if you want to volunteer, please make sure you follow us and visit us at www.longbeach.gov/COVID-19 and click on there, I want to help, and there'll be a volunteer link for you to engage. Mayor, that's it for the questions from Facebook and from our media. If you would, you can continue on, sir.
Thank you. And then I will turn this over to Alice to do a recap for us in Spanish. Thank you.